So blockchain and crypto are in the news a lot these days, mostly in the context of supply chain, finance. Investors have jumped on blockchain technology, cryptocurrency technology companies in a big way. I think Bitcoin is at 34,000 per share today. I remember many years ago, probably the first time I met you, you had given a presentation on blockchain and healthcare that I found to be really enlightening and eye-opening for me. Are we now starting to see the use of blockchain and crypto become a reality in healthcare?
That's an interesting question, and you're right. Back in the 2016 timeframe, when the Department of Health and Human Services was having their blockchain challenge and just really exploring the possibilities, starting to look at different use cases, and challenging the startups or the big vendors to make it happen, we what we were really dealing with was investors putting a lot of money in place and also the fear of missing out. And that was actually driven by the cryptocurrencies, by the Bitcoins of the world. We've come a long way from that time frame. And one of the things that I talk about and kind of laugh at is there was an article by researchers back in 2018 saying that the year of blockchain in healthcare was 2018. That actually didn't happen. It's kind of in that 220, maybe 220, 2021 time frame, but we are seeing more viable use cases, particularly when it comes to track and trace uh, for supplies, for medications. Think of it. I had an example, and this frustrates me because I love this example, but it's frustrating that we haven't done this yet. Is if we'd have been able to track the COVID
Mhm.
vaccine development from the research through the manufacturing process, clinical trials, all the way to getting it into the arms of people like us who are the
Yeah.
healthcare consumer, the patients, using track and trace, using cold chain technologies, we wouldn't have these distribution and logistic problems that we're having today. We'd know where they all are. We'd know when we'd have the data that tells us
Mhm.
exactly what's going on and what we need to do more of. But the good news is that viable blockchain infrastructures and what I call subsystems are here to support those use cases.
Well, that's really interesting. You talked about medication management, adherence management. I think those are certainly, people can look at that, search those things. We're certainly seeing progress as far as these technologies being introduced into those workflows and those processes. But let's talk a little bit about medical record tokenization. So some people may be starting to hear that term more and more. Can you talk about and just describe a little bit what is medical record tokenization?
So it's really the application of a blockchain, and I'm going to say a permissioned blockchain, which has more controls in it. The use of access control lists, the use of permissions, the ability to only give access to the information that a person has to see. So in traditional blockchains like Bitcoin, once you had a node and you were on the network, you see all the data. That's the beauty of a Bitcoin blockchain is everybody uh, gets to see the data. Data is democratized. That doesn't work in healthcare. So beginning with that, if you think of the electronic medical record and even the rules of HIPAA or other privacy standards around the world, is you only get to see the data that you need to do the job that you need to do, when you need it, where you need it, why you need it, and for as long as you need it, uh, those types of parameters. So as we start to tokenize the medical record, it doesn't mean that we put the medical record on the blockchain. It means that we use blockchain capabilities such as a hash or what's called a Merkel tree to point to that medical record, to have those permissions in place, but also to put the patient at the center. So now, as we begin to tokenize, what we're really doing is adding value, and we're incentivizing patients to do certain things like share their data with
Mhm.
researchers and share their history, making research a lot more viable, making it a lot richer, maybe even share their data with someone who's putting together a clinical trials patient registry so they can find potential candidates much more quickly. But it also means the patient gets value back to them. If it's value towards their insurance coverage, it's value towards their medications, if it's just value towards the way they interact with their caregivers. And some of the very interesting project that I had the privilege to work on with some orthopedic doctors is tracking implantables on
Oh,
a
wow.
blockchain. Yeah, and now
That's
listening
fascinating.
not just to how the implant was manufactured and how it went through the supply chain and how it was implanted in the patient, but the aftermarket experience of the patient. And now the patient becomes involved in an ongoing dialogue with the caregiver and the manufacturer. So the manufacturer is learning from that wear and tear, from that experience, and they're able to add additional value through apps or through other supporting services, but also now start to predict when that patient might need that implant in place, for example, replaced,
Hmm.
for example. So
Or how to tune it maybe as well
how to tune it, yeah,
for that
because
patient or
these
future patients.
devices. That's a great, yeah, it's a great point. We think of devices as doing one thing and not being tunable once they're in your body. But again, with the use of IoT, with the use, everything has a chip in it nowadays.
Yeah.
We are able to make those adjustments. Absolutely.
Yeah, and it makes me think about that particular use case makes me think about probably 10 other use cases. So
Hmm.
I think we are now able to imagine how this technology could be used before. I think we were just having a sort of a visibility issue before back in 2015, 2016 as to how this is going to get done. So it's great to see that it's evolved to the point where now we can actually start to imagine these use cases. And as all innovations, once we imagine, then we do. So hopefully we'll see more and more of the use cases as far as blockchain and crypto in healthcare is concerned. Um, you know, thinking about healthcare and the healthcare market as it is today, and we talked about the use cases around blockchain. What do you feel should EMR vendors, other healthcare, traditional healthcare software vendors, is this something they should be starting to include and incorporate within their core products? Or do you see this as being sort of bifurcated where you have these startup and other technology solution companies that focus on this technology, but then the EMR vendors are separate, and then now it's up to the healthcare CIO to bring this all together to make it work in a way that does provide value not only to patients but to their providers as well.
Yeah, the healthcare industry historically has been plagued with the need to buy separate applications, very separate applications for everything they do, particularly in the acute care setting, in the academic medical centers, where your electronic medical record isn't integrated very well with your supply chain or your human resource systems, or even other supporting systems, your lab systems, your medication management and dispensary type of thing, systems and solutions. We're seeing that integration come together much more nicely. We're also seeing obviously big efforts in interoperability, beginning with the shift over to the fast healthcare interoperability resource or FHIR standards. But blockchain is an interesting technology, and with blockchains with EMR vendors or even ERP or HR supply chain vendors, they're not really good at that, but they are really good at understanding workflows and processes. And what we're starting to see on the ERP side, the human resource side, for credentialing, for supply chain track and trace, we're starting to see these subsystems based on blockchain capabilities built in and more tightly integrated. On the EMR side, I'm not sure yet today that there are any EMR vendors that are that good that they can take an Ethereum blockchain, for example, or a Ripple and build it in to their solution. Maybe in the future, I'm not sure if it's going to be during my the remainder of my career, but I think these vendors need to do a better job of starting to work together. So um, hopefully the integration won't be left up to the hospital CIO and CTO. That has been a challenge.
Yeah.
I used to be a middleware developer. I did a lot of integration work. There's a lot of money and resources and time that has to be spent doing that. What I'm hoping is that the vendors will come together and more of these blockchain type of cloud services will be leveraged and used by these EMR vendors to present a more complete, a more integrated, and better together solution to the end user.
I like that term, better together. And, I guess if we had some advice for Judy Faulkner, it would probably be to start a partnership ecosystem, maybe a crawl, walk, run approach, if you will, to
Uh,
start to get there. I think, in all seriousness, the pandemic and COVID and the examples you've given already so far, and I think a lot of us can see how the blockchain could have been applied to COVID as well. It's just something I think EMR vendors are going to have the capability to do going forward, to be part of the public good, the public, the support that we all need, as this pandemic has really highlighted that technology is just as big a part of solving for these really global issues of healthcare as any service provider or any government or anybody else. I mean, technology is front and center, and platforms specifically, I think, front and center.
Absolutely, absolutely, and I think you're spot on. These EMR vendors have to come together. They have to focus on really supporting interoperability, which they are to an extent,
Sure. Yeah.
but they have to create these marketplaces with real purpose and people understanding what the real value is that comes by doing it in one place. And we can come up with multiple use cases. Obviously, COVID has taught us a lot about having to track vaccines, about having to be better at understanding the manufacturing process and supply and demand around PPE. And just think again, if we had integrated supply chain
Hmm.
catalogs, it doesn't mean that we get rid of all these suppliers. It just means we have better visibility into the bigger picture of who's doing what to supply that demand. We can make a significant dent in eliminating shortages. I always say to people, EMR systems are great, but hospitals cannot operate without the supplies, without the people in place. And that's what's really broken today.
Though I do think there is a lot of opportunity that, the ship has not sailed yet. I mean, think about the amount of people that still need to be vaccinated in the places that it's going to be very difficult to manage and monitor that supply chain. Again, this type of technology could be a real boon to those efforts of really solving some, real world problems that a lot of these countries are going to face in getting their populations vaccinated.
Yep, absolutely agree.